Hello and welcome. We are from SGD B10 and we are here to present to you our presentation about Ptosis. Here are our members. So let's just start the presentation.
Hello everyone, my name is Putura Natalia Anggreni with student number 217. So I will explain to you the background of ptosis. So ptosis is a condition in which the upper eyelid droops abnormally in primary vision, which can cause complete or partial obstruction to the superior visual field. And ptosis is important because even though ptosis is not likely to cause death, it has some impacts on the patient's life. The degree of ptosis also determines how severe the ptosis in the patient. Ptosis can result in change in facial appearance and making the sufferer face looks like a tired face.
My name is Aurelius Filibertus Nongvito with student number 128. I will continue the presentation. I will discuss the research questions, which includes what is ptosis, how is the normal physiology of eyelid, how are the epidemiology, pathophysiology, classification, diagnosis and diagnostic method, treatment and risk of treatment, and prognosis of ptosis. The purpose of this student project are to understand what ptosis is, to understand the normal physiology of eyelid, and to enhance the knowledge about epidemiology, pathophysiology, classification, diagnosis and diagnostic method, treatment and risks of treatment, and prognosis of ptosis. And the benefits of the student projects are public can be aware of ptosis and its causes, as well as its treatments. Medical community can further understand about epidemiology, pathophysiology, classification, diagnosis and diagnostic method, treatment and risks of treatment, and prognosis of ptosis. And authors can enhance the knowledge about ptosis and fulfill the student project assignment in the Visual System and Disorders block of undergraduate medicine and medical professional study program of Udayana University. That's all from me. This presentation will be continued by my friend. Thank you very much.
My name is George David, number 74. So definition of ptosis is abnormal upper eyelid in one or both eyes, also known as blepharoptosis. The symptoms: lid crease absent, lid to superior field blockades, based on age categories as congenital and acquired. And the most common cause of congenital ptosis due to failure development of levator muscle, and the most common cause of acquired case due to aponeurotic problem. That's all from me. Thank you.
Hello everyone, my name is Putri Emilia Dewi with student number 038. So I will explain about the epidemiology of ptosis. Ptosis occurs at any age and has no sexual predilection. In 2009, a study on 40 until 64 years old in North Ireland found that the prevalence of upper eyelid ptosis was 4.7%. There were more unilateral than bilateral ptosis cases in the population. Ptosis incidence also increased significantly due to diabetes and hypertension. Meanwhile, in 2018, a study in two villages in Ireland found that 2.23% of the population had ptosis. Within the majority, 45.3% of the cases were bilateral ptosis, and most cases are observed in above 70 years old patients. The lowest prevalence was found in 21 until 30 years and under 5 years age group. And the study also found that low academic education levels have a higher prevalence of ptosis, and the incidence of astigmatism also higher in the patient with ptosis.
Good evening, doctors and friends. My name is Anish Sharma with name three last digits 251, and I'll be elaborating on the etiology and risk factors of ptosis. So the etiology of ptosis, there are various causes of ptosis ranging from the natural causes to the more serious conditions. It is usually more common in older adults due to the process of aging. As the person ages, the levator muscles may stretch and cause the eyelids to fall as a result. However, in children, the levator muscles are unable to develop properly. At times, the exact cause may be unknown, but it may be due to trauma and may be neurological. The risk factors of ptosis are people with certain medical or serious conditions. Medical conditions including nerve surgery, temporary style LASIK surgery or cataract surgery, serious conditions such as stroke, brain tumor, or cancer, or patients with neurological disorder affecting nerves or muscles such as myasthenia gravis are also at risk of inheriting ptosis. That is all from me, and thank you for listening.
Hello, doctor and friends. My name is Giovanka Francia Purnama with student number 148, and I will explain about the normal physiology of the eyelid. So the eyelid is one of the most important organs in the eye because it is a protective organ to prevent injury and other microorganism infections to the eye. The eyelid will automatically close in the threatening situation, such as a rapid movement of any particle, touches, and excessive light. The eyelid helps to spread tears all over the eyeball, so the eyeball keep being moist and remove any particles from the eyeball surfaces. Eyelid movement is controlled by frontal area of occipital visual cortex, especially in the promotor area above Broca's area. The eyelid covered by thin skin in outer part and transparent mucous membrane called the palpebral conjunctiva in inner part. The main muscle of the eyelid is levator palpebrae superioris, which we can see in the figure on the right side of this presentation. The blood supply came from ophthalmic and supraorbital arteries, a branch of internal carotid artery. The innervation comes from cranial nerve 3, or usually called oculomotor nerve. The damage in the levator palpebra superior or even the innervation can cause a disease or symptoms called ptosis.
Good morning, doctor and friends. My name is Shannon Kalista, name 015. Now I will continue the presentation about the pathophysiology of ptosis. So, it is known that there are two muscles of the upper eyelid that are responsible for its elevation. First is the levator palpebra superioris, or known as LPS, which is a striated main elevator muscles that's supplied by the oculomotor nerve or cranial nerve 3, where the origin is the lesser wing of the sphenoid bone. Second is the malleus muscle, which is a smooth muscle that also attaches to the superior tarsal plate with sympathetic innervation. There are some pathogenesis for ptosis, such as first is aponeurotic ptosis due to aging, is the common pathogenesis which the levator muscle starts thinning and begins to lose muscle tone. Second is disinsertion or dehiscence of the levator aponeurosis can also cause ptosis. Other risk factors such as intraocular surgery and chronic inflammatory diseases that disinsert the levator aponeurosis from the tarsal plate can also cause ptosis. These risk factors can more likely to develop into involutional ptosis. Besides age-related aponeurotic ptosis, a recent histopathological study revealed that oxidative stress of the levator aponeurosis also plays a potential role in its pathogenesis. That's all from me. Next will be continued by my friend. Thank you.
My name is Inyuman Wigah Yoga with NIM 109. I will explain about the classification of ptosis. Ptosis generally can be classified as acquired or congenital. Based on underlying pathogenesis, it also can be classified as myogenic, mechanical, aponeurotic, neurogenic, and pseudoptosis. Myogenic is when the muscle that elevated the lid suffer from either systemic or localized neuromuscular disease. Mechanical may occur because periocular edema or superior orbital mass. Aponeurotics is the weakening of tendinous attachment between superior tarsal plate and levator aponeurosis, usually found on elderly or people who use contact lens. Neurogenic is the disruption of cerebral nerve 3 or oculomotor. It can cause the paralysis of the levator muscle. And pseudoptosis is condition that mimic ptosis. Most of the time, it's caused by dermatochalasis or extraocular muscle pathology. Proper examination must be done to differentiate this with other ptosis.
Good afternoon, everyone. My name is Marco with NIM 057. I will present about the diagnosis of ptosis. The main symptom of ptosis is the sagging of upper eyelids. Ptosis may also affect vision in certain cases. In patients with unnoticeable sagging of the eyelid, they usually have extremely dry and watery eyes, as well as exhausted or weary looks. Other symptoms of ptosis include double vision and difficulty to close eye or blink. For examination, there are some physical examination. First one is checking patient visual acuity. The second is extraocular changes. The third one is papillary light reflex and upper eyelid band, palpebral fissure length, and the last one is marginal reflex light. On the other hand, for the test, the first one is eyes test. Eyes pack put into glove and test into the closed ptotic eye for 2 minutes. If the eyelid goes up, it is suspected as myasthenia. Second is tensilon test. Where 2 mg of hydrofenium is inserted gradually in 15 to 30 seconds. Ptosis will develop after insertion if myasthenia was the cause. The third one is phenylephrine test. Could be injected below the eyelid to test molar muscles. The fourth is skimmer test to assess the tear function, and the last one is pre-tartal test to inspect the symmetry of the eyelid. Okay, that's all for me. Thank you.
Hello, my name is Madeline and my knowledge digit number is 093 and now I will discuss about the treatment of ptosis and their risks. There are some ways for treating ptosis by undergoing surgery or non-surgery. For non-surgical, the first thing can be done is giving stimulation by electrical or mechanical so the muscle can be loosened. The second is by using aprofloxacin hydrochloride, which contains selective alpha-2 and weak alpha-1 receptor agonists that can help the eyelids to air free. On the other hand, the long term of using this drug may cause some sensitivity and a risk for developing closed-angle glaucoma and miosis. And for surgical procedure, there are some techniques. As seen in the table, there are 5, such as vaginal laser fat, levator resection, and levator reinsertion, frontalising, and Mueller resection. Generally, the complications of surgery include overcorrection, corneal exposure, undercorrection, sling granuloma, notching of the eyelid, and infection. Thank you.
My name is Komangjani Putri, number 031. The prognosis of ptosis is divided into a good prognosis and poor prognosis. A good prognosis is demonstrated through appropriate surgical procedure with appropriate preoperative evaluation. Preoperative assessment and proper post-operative care with close monitoring has been shown to improve the prognosis of surgical procedure performed in all types of ptosis case. And a very poor prognosis is indicated by correction with levator resection instead of fasciolata sling procedure in case of ptosis with poor levator function.
Hello, my name is Pusaka Parabita with NIM 170. Ptosis or blepharoptosis is a low-lying upper eyelid in one or both eyes that occurs at any age and has no sexual predilection. Normally, elevation and retraction of upper eyelid is controlled by levator palpebral superior muscle and molars muscle. The loss of the innervation or the loss of muscle tone of these muscles will cause ptosis. Oxidative stress of the levator aponeurosis may also play a role in causing ptosis. According to its pathogenesis, ptosis is classified as myogenic due to neuromuscular disease, mechanical due to periocular edema or superior orbital mass, aponeurotic due to aging, neurogenic due to disrupted innervation, and pseudoptosis, a condition that mimics ptosis. Symptoms of ptosis include sagging of upper eyelid, impaired vision in certain cases, extremely dry or watery eyes and exhausted looks, double vision, and difficulties to close eye or blink. Generally, diagnosis of ptosis can be made through physical examinations of the patient's visual acuity, extraocular changes, etc. However, several tests may be needed to further confirm the diagnosis or to know the underlying pathogenesis. These tests include eyes test, tensilon test, Schirmer's test, etc. Treatments of ptosis may be non-surgical or surgical. The non-surgical procedures include muscle stimulation and medication, which is proclonidine hydrochloride. The surgical procedures are vaginal Servet procedure, Muller's muscle conjunctival resection, frontalis sling, etc. These surgical procedures may cause complications such as overcorrection, corneal exposure, undercorrection, sling granuloma, notching of the eyelid, and infection. Most often, ptosis is not severe enough to interfere with daily activities, but in some cases, they may block the patient's vision and hence interfere with daily activities. The prognosis of ptosis depends on the ptosis type and management. Thank you.
That is all about our presentation. Thank you and have a nice day.